Welcome everyone. This is Professor Leo Da Vinci channel by Allied Health Society for Asia Pacific. Today, our topic is about the structural approach for COG thread rhinoplasty. Nose is at the center of communication triangle of the face. Its aesthetic role is very important. There is a number of nasal configuration problems correctable by COG threads, including low set radix, inappropriate height of nasal ridge, broad or narrow ridge, nasion hump, deviated crooked nose, decreased nasal tip projection, alar-columellar deformity. The method is much less invasive than traditional rhinoplasty, while less risky, more flexible, and structurally amendable than fillers like hyaluronic acid. This presentation is to illustrate different structure approach for correction of the nasal problems through COG thread rhinoplasty. The nose structure is supported by bony and cartilaginous parts. The main problems of Asian nose are deficiency in support and deformity in support, and the problem may occur in the nasal bone as well as 5 different cartilages of the nose. By using thread treatment, most of these problems can be solved. How to assess the nose? First, we ask the dorsum of the nose whether there is low set radix, too low a nasal ridge height, the platform of the dorsum is wide or narrow. Also, we assess the presence of nasal hump and crooked deformity of nose. Then go down to the tip to see the projection. Last but not the least, we assess the AC configuration. First is to assess the dorsal and radix height. Being too low will lose the aesthetic 3D contour. Moreover, too wide a dorsum is also aesthetically unpleasant. Nasion hump has 2 types. One is the high type, occur more in Westerners. Solution is only by surgery, while the other one is the low type, found more commonly in Asian. This can be dealt with by thread treatment that camouflage the deformity, like the excessive low radix and derotation of the nose tip. Crooked nose can be congenital or acquired, for example, trauma. This can be camouflaged by constructing a straight overlying contour above the deformity by threads. Loss of tip projection is common in Asian nose. This is usually due to loss of cartilaginous support. In mild type, we may rectify it by rebuilding the dorsal and columellar supports, but in severe type, we may need to use the thread to rebuild the pyramidal support by strengthening the lower lateral cartilages, LLC, in the alar. AC deformity is either by too retracted columellar or overdragging of floppy LLC. Thread treatment can definitely correct the deformity.